and I hope you're keeping the conversation going on our socials. You can text us on Imani Television Facebook page. You can also do that on our SMS line 0746 7805880 if you have any questions, any suggestions, any story you might be having, a testimony. Maybe you had TB at some point, or your family member or your friend. We would like to know what was the experience like for you. Of course, you can also text me on my Facebook page at Sylvia Nyongesa. Remember, all our contacts ziko hapa zinapita chini ya screen yako, so you can talk to us any other time, ask your questions, and as usual, daktari atakuwa anarudi studio kuzijibu hizo maswali. Now, we had just talked about pulmonary TB. We talked about what it is, what are the causes, and who is at risk, what are the risk factors of getting TB. That's why we talked about smoking. We talked about all those things, being in a crowded environment and things like that. But now we're back and we are going to talk about the complications. You know, without treatment, any disease could be very fatal, in fact. And sometimes one disease can move to another part of the body as well. It can get serious for you. So what are these complications that can arise from TB?
Some of them are tuberculosis can affect your brain, it can affect your brain, it can affect the liver, the kidney, and some of the tissues lining the heart. Yeah, also can also affect your bones. Yeah, it can affect your bones.
Okay, yes. So those are just some of the...
Yeah.
Does it have anything to do with the heart disorders or things like that?
Yeah, that's why I'm saying it affects those. This is what we call inflammation of the tissues surrounding the heart. So it affects those tissues, but of course it will affect your heart. Yeah. Okay.
Is there any correlation between TB and meningitis?
Not really. Not really, but you know, meningitis, we call them the differential diagnosis. Meningitis, it looks like malaria. The signs and symptoms of meningitis and malaria, they are almost similar. That's why normally, initially we used to treat, if a case of malaria, we treat malaria, but we never used to handle meningitis. We came to realize that most patients were dying from meningitis and we were treating malaria. To reach that time now we combine. You treat malaria at the same time you treat meningitis. So meningitis and malaria, they go together. HIV and tuberculosis, they go together. The signs and symptoms are almost similar. And then treatment is the same. HIV and tuberculosis. So people normally mistaken, if you are suffering from tuberculosis, they think you have HIV.
Okay, Daktari, just hold that thought kidogo. We will come back to that, but for now, let's talk about prevention first, before we go talk about treatment, and then now you'll explain to us how the, sure. Let's talk about prevention.
So prevention, tuberculosis is, one of them is, there's what we call cough etiquette. When you cough, you know, you don't know who is having tuberculosis, just use your handkerchief, then sanitize your hands before you greet one another, because some people have a bad habit, we call it bad health habit. They cough using their palms and they greet their neighbor, not knowing that you have already transmitted bacteria.
Yes.
That's because tuberculosis, transmission of tuberculosis is through droplets or sneezing or coughing. So we might be spreading tuberculosis unknowingly. Another thing, avoid overcrowded areas mostly, because you never know. Avoid those crowded, especially in our houses. We normally encourage people, when you construct your house, just put enough ventilation so that when you are sleeping at night, in case there is a case, that circulation of air. You know, circulation of air in a room, it is science. It is science. It knows a lot of things. So it is good to fix adequate ventilation so that the disease can easily move out of the room. Another thing, prevention is is vaccination. There is a vaccine. We call it PCT. When children are young, they are taken to clinics to get that vaccine so that their body can be able to create its own antibody against the tuberculosis. So vaccination is the best. In fact, it's the best. It creates permanent antibodies in your body to fight against that disease. Yeah.
Okay, so let's go back now to that issue of treatment of TB.
Yeah, treatment of tuberculosis, as I said, is the same as HIV/AIDS. Normally, a patient with HIV/AIDS, the first opportunistic disease that comes is tuberculosis. Because now, you know, tuberculosis is in the body. Once the immune system is compromised, it becomes active. So that is the first case that comes. So treatment is the same. We have drugs, Amto, Niacid, and so on. It is a combination of the chemicals. So a patient who is not having HIV viruses but has tuberculosis can be treated and become okay. But if you have HIV/AIDS, then at the same time you have tuberculosis, you only manage the conditions, but you will not, it will not go away. Yes.
You know, some people would actually just tell themselves that TB has no cure. Perhaps you can explain that. Does that mean it is really impossible for someone to get better, or does it mean they get tired of the treatment that takes a long time?
Tuberculosis has a cure. The only problem is people or patients get tired of taking the drugs. You know, you have to take the drugs continuously for some months, 6 months, 9 months, until it's not easy for it to go out of the body. But if you follow what you are told by your doctor, it will get cured. So some people reach somewhere, they stop taking drugs. Then they develop what we call, there's a condition we call multi-drug resistance tuberculosis. So when it becomes resistance to those drugs, it becomes a problem. Yeah, it becomes a problem. You can easily go out.
Okay, so Daktari, maybe some tips for someone who has been diagnosed with TB. What can you advise them in regard to making sure that they actually get better and making sure that they protect their families and loved ones?
Once they are diagnosed with the tuberculosis, just follow the instructions that are given by your doctor, because they are normally instructed what to do, how to stay at home, how to stay with their relatives, and then how to use drugs without escape, without we call it pirakuruka, hata siku moja. So that because the moment you skip 1 or 2 days, the means you start afresh. When you skip 1 day, you have interfered with that addiction. You start afresh. So it is good to follow the instructions and then you'll get better.
Okay. Well, thank you so much. We've been talking about TB, and of course it is very important that even as we talk about fighting TB and treating TB, it's very important that you protect yourself and your loved ones. That's why we've been talking about prevention. Remember, kila siku watu tunasema hapa, if we really take care of the prevention part, we really emphasize on that part and take real caution about it, we won't even have to talk about these causes. We won't have to talk about treatment. We won't even have to talk about diseases in the first place. So it is very important that you take keen. You really be keen when you're talking about the prevention measures, so that we ensure that we are safe. And of course, finish your medication as prescribed. Ensure you follow the dose, follow through with it until the end. Ensure you take care of your family. You know, ventilate your houses, your offices, whatever spaces that you're in. Just ventilate them properly. Wash your hands. Hygiene is very important. Sanitize if need be, and cover your mouth and nose whenever you want to laugh, whenever you want to sneeze, whenever you want to cough. Very important, so that we curb the transmission of TB. So Dr. I'll just give you a minute or two to talk to your viewer.
Yes, what I want to advise them is that we have for Paddy Celebration Day, just move to the nearest health center, which is testing or screening tuberculosis, to know your status. Then you know how you seek those medical services.
Well, thank you so much, Dr. for coming.
Thank you so much.
Yeah, it's always been insightful to have you in here to teach us one or two things about our health. So my name is Sylvia Nyongesa. Thank you so much for watching. Well, let's keep the conversations going. Let's keep talking about these things on our socials. My handle is Sylvia Nyongesa 5 on Twitter, on Facebook, Sylvia Nyongesa Facebook page. Talk to me. Tell me what you think about the show. Talk to me about what we discussed. If you have any questions, send them in, and we will be talking about that on our next episode. But until then, stay healthy.